Hey everyone, I thought I would share a case presentation today that we had with someone real who came into the office having knee pain. This was a runner having pain at the top part of the knee, right around the area, right around here, okay? It wasn't on the kneecap, it wasn't on the patellar tendon, it wasn't around the sides, it didn't feel like it was swollen, and there was also a quad cramping type of feeling associated with it. He noticed it actually increased when he was running. You can feel it with each step as he started to hit. Also with hopping. He could duplicate it just by hopping 3 times on the involved side while the other side can go as much as he wanted to. In this video today, I'm going to cover a little bit more of the case presentation, so maybe it'd help you guys find an answer to your problem. And we're going to show what we did also at Performance Place to help him out find a great reduction in his symptoms on the very first day. I'm Sebastian at Performance Place Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. We have a lot of people with knee pain, but a lot of people don't always have it in the location that this gentleman did, which is the interesting thing. When you have a knee problem, it's important to identify the location of where you have it first. A lot of people will have it under the kneecap or deep to the kneecap, almost like if they grab the kneecap, they can move it around like this and it feels like it's kind of grindy underneath. Other people feel on the actual tendon itself down here, or it'll feel swollen on the tendon. Those are things would be a little bit more associated with chondromalacia patella or runner's knee, or even patellar tendonitis down here. A lot of times people feel swelling from the inside, which it feels like there's a plastic bag expanding inside their knee, or it's painful with twisting that may be more meniscal in origin. And these are typically not trauma related. So this guy, it was interesting because it started to come on. There was no trauma associated with it, but the location was interesting. The location right up into here, you may say is a quadriceps tendonitis or tendinopathy, but there's not a lot of people that you've probably seen or people who have had problems with the quadriceps tendon itself. I certainly have not seen a lot of them, and I've been doing this for quite a few years. So we got to ask ourselves, when this person's having this problem, what is an easy way we can take load away from the knee, yet keep him doing some of the activities that he wants to do, which is running and cycling. So one thing that we did, at least in his situation, was we screened out the knee to first make sure that it's working well, it's not going to fall apart, there's nothing really big, bad, and scary associated with it. The only thing he had positive with the knee was doing some resisted testing, which is just this. I put my hand right here and I told him to slowly kick, and that started to increase his knee pain. Pushing up this way was fine, pulling down was fine, but this way was duplicating his pain every single time. Now, you have to assess above and below the knee to figure out what to do with these people. If you have not had anyone evaluate your hip, your core, your low back, and your foot and ankle in regarding your knee, you need to find someone to help you do that. We can do that here if you'd like. We assessed his hip. His hip range of motion was actually pretty good in a lot of ranges of motion, but it was lacking in just one. So we had him on his back, we brought the knee to his chest, he didn't scream, it felt normal, and it was comparing side to side, it felt okay, both equal. Also, rotating in this position is nice to find. Normally we like to see that if I was looking down this way, you'd see that I can see like the outside part of my foot just peek out. That's generally enough, especially if it's generally symmetrical on both sides. And this way is going to, just if I dropped it down, it'd probably hit my opposite thigh. Those are just a few things. Also doing this, normally like people won't have it like way up here. If you do, then there might be something associated with your hip creating your knee problem. But really he had a limitation in extension of the hip. And we all know that runners, human locomotion requires extension. It requires the hip to extend to some degree, or else you're going to get movement in other locations. In this case, it seemed like he was using his knee more. When we did the opposite side, we saw that his thigh, as we started to passively, I moved his leg up, so he wasn't helping me. He moved his leg up, and we can see that about half his thigh could unroot from the table. On the involved side, it was kind of just stuck. if you can take a peek at my knee right here, I know the camera is almost limiting this view, but it's like not really up, and it's almost like it's still weighting down on the ground. And that's kind of where he was at. We assessed internal and external rotation here as well, and it wasn't limited at all. So we just asked him to extend his hip. And the way we did this was a standard hip extension exercise, which you guys might see as a hip flexor stretch. In this case, we didn't really care what it did to the hip flexor. We cared to expose the hip to extension, so then within his running or his jumping, he'll utilize the hip more because he has more motion or availability. To be clear, his hip did not hurt. So in order to do this, we found that this was the involved side. We put a pad underneath his knee to make it feel comfortable. I had him push his foot out into my hand, which was back there, and we just had him rock his hip pocket towards the ground in front of him, okay? As he started to get more and more range, because that did happen after about 10 reps, we had him creep this foot out a little bit more and then rocking a little bit more, okay? As we do this, he noticed it wasn't really painful to do. His knee didn't hurt, his hip didn't hurt. It just felt like I was having him do a stretch, and he did about 30 of them. After that, we went back to the test that he could duplicate every single time, which was a single leg bouncing or jumping. He actually went a bunch. He went probably about 15 reps or so, really without complaining. He's like, oh wow, I think it's better. Then he checked the other side just to see too. And it was generally about the same. So what we ended up doing later with him is we like to take the process of when we found an area that's really not painful but creating more motion or more use out of an adjacent joint like a knee, we like to passively mobilize it, actively mobilize it, and then load it. So the way we did this was after that a banded bridge, which I won't cover today, and we also did, what did we do? We did a single leg hinge, which is like a wall version of a single leg deadlift without any weight, just to patterning the movement, because that was challenging for him too. He walked out feeling much better. And so the route we're going to take on him is, assuming it's right as we go forward, because this is only session 1, is we need to make sure his hip on the involved side knee continues to keep the range of motion, and actually that the range of motion starts to express itself in his sport, because the whole point is getting back to running again. So I believe that he said he's had this thing for, I think it's been like 3-4 months, and nothing's really changed it. So we're gonna have to see, proof's in the pudding here, but these are the cases that we see here in regards to the knee. There's more complexity than just doing something specific to the knee. A lot of times if you work around the knee can reduce symptoms immediately, but to keep it away, you have to make sure that you load the entire limb with a challenging exercise, and usually that's where the magic happens there. So the funny thing is, I've noticed that people over the years, they tend to think that it's gonna take a lot of time to reduce pain. In most scenarios, it doesn't. When you're in a scenario like him, where walking doesn't hurt, sitting doesn't hurt, bending doesn't hurt, it's just hopping and running. Those are only 2 things that bothered his knee. So it's very circumstantial, it's transient, it's there's a way to get around that a little sooner than pain that's always there, like an inflammatory or swollen knee. So I hope that was helpful to you guys. We do have other videos on knees on our channel. We have a lot of other videos on stretches and exercises for the knee. So if at any point you feel like you want to work with us, you definitely can. We're in Costa Mesa, California, but we do see people virtually and in person for this too. Just programming exercises and giving really good targeted suggestions to figure out what you actually need versus giving you a sheet of stuff to do that's not going to work with you. So subscribe to the channel. We'll see you guys next time.